So every single patient that comes to the door as a new patient will receive a full set of photographs, radiographs, but now a 3D scan. And from this 3D scan, we can produce a number of appliances.
Welcome to Series 2 of the Future Health Podcast, a podcast on the way we work, the work we do, and how technology will influence the future of work in New South Wales Health and the healthcare industry. We have an incredible lineup of guests this series, and we're looking forward to sharing it with you soon. Feel free to like, share, and subscribe so you don't miss a thing. Hello, and welcome to the New South Wales Health Podcast. Today we are catching up with Dr. Celso, dentist in Burwood, to talk about how the future for dental practice, what the future for dental practice looks like. Dr. Celso, thanks for having us here and discussing this. But firstly, would you like to introduce yourself to us, please?
Of course.
Yeah.
Thank you for having me, Amit. You can call me Celso. I'm a dentist here in Burwood. I've been a dentist for 15 years now. I graduated from university in Brazil 15 years ago. And after university, I've done a master's in palliative care and chronic pain management. And at the moment, I'm studying a master's in psychotherapy at the University of Sydney, which has nothing to do with technology, which we're talking today. But my background in technology is all self-taught. I was always a tinkerer. I always loved playing with computers since I was 5 years old. And this is where my love for technology and its application to dentistry comes into play.
Ah, great. That's really interesting because having worked from Brazil and then come over to Australia and also been in dental practice for long and seeing all the things around you, you obviously have seen a lot of change in dental practice over the years. I, for myself, have noticed it as a patient. How would you say practice has changed over the years since when you first started to now?
Dramatically. So I think one of the important things to me is that I spend a lot of time now not actually chairside, not next to the patient. I spend a lot of my time on computers, which is not what I signed up for when I started doing dentistry. I was thinking I was going to spend my time always next to patients, but that's not what it is nowadays. We spend a lot of time planning things and doing presentations and treatment plans on computers, away from the patient. That improves the patient experience though, because when they come here, I have less to do on them. They can spend more of their time away from the practice, and when they come here, things are already ready to be inserted, implemented, or done to the patient. So this is one of the changes. We spend a lot of time away from the patient. And away from the patient doesn't mean they are still in front of mind, but they are just not physically here with me at the practice. A lot of the things that we do nowadays will start with a scan, as we see here next to me. This is a 3D scan, and essentially we capture the patient's teeth. And with this, essentially, I can have a copy of the patient exactly as they are, which was impossible before. We would have a copy in plaster before, which is the traditional way of having teeth for us to work away from the patient, which was very subpar. It's completely different than having a 3D image that I can turn around and manipulate digitally and then print if necessary.
You could easily see that changes a lot of practice around triaging, planning for patients. And which brings us to the most recent challenge of COVID. How did you see things evolve during that space, now that you say that a lot of your work is in the back end? Because for me, virtual care, virtual dentistry, I would think, it's almost unheard of.
Yes.
But clearly there are certain applications now where you are doing a lot of virtual care in dentistry.
There is. Even though dentistry is a very procedural specialty, we don't do a lot of things that are not procedural in dentistry. It has changed. For instance, a lot of the consultations that we do nowadays are virtual. It happens every single day that patients will not have to come to the practice, and we can discuss with them problems that we know already exist, and we are in the middle of a course of treatment, or we are presenting a treatment plan, for instance. Having the technology of 3D scanning, coupled with, of course, the records and the x-rays and things of that nature, will give me the ability to discuss with the patient what I already know. So if you call me and you say you have a problem on a tooth in the lower right-hand side, well, I'm just going to pull up your scan. Let's look at the lower right-hand side. What do we have here? We have this, and that. We can just zoom in and see, okay, so Amit, what's happening to you is this. This is what we're going to have to do next time. Or you don't have to come and see me actually, because this we can just monitor. We can just stay at home, take this drug, do this thing at home, and we're going to see you again in a couple of months or whatever is required at that space. The other thing that has changed during COVID, the ADA, so our association, the Australian Association, has pushed through an item number for telehealth, which we didn't have before. It was not something official that we could actually consult virtually. And I always had pushback from patients when suggesting that we do a virtual consultation to present a treatment plan, for instance. This has changed. Every single patient knows what Zoom is. And even if they don't work remotely, they are willing to give it a go with us. So for me, it works quite well. One more change with COVID was monitoring of orthodontic patients. So when patients are going through braces or Invisalign or some type of orthodontic treatment, we normally would have to see the patient quite often at the practice. Because during COVID, we wanted to minimize physical visits to the practice, a lot of the systems were turned to online, where we give the patients devices to take records of themselves at home, and I'm going to monitor them virtually. So this happened during COVID, but it's definitely going to continue happening like this, where I can minimize their visits here from instead of every 6 weeks to every 12 weeks.
And it obviously works well when you have a patient for a whole orthodontic dental plan, or you doing it end to end. So for you, it makes sense, economic sense, to not have them here either. So you could probably fit in patients through, even if you could do it from home if you wanted to.
Certainly.
But is there a change happening in the private health billing sector in that area too?
So after that item number was pushed from the ADA, the health funds started to pay a benefit on those items, but it's very small. It doesn't really make a lot of economic changes from that sphere. But I do have less. I have to see the patients less time here, so I have more chair time available for other procedures. But from the patient's perspective, I actually see them more often. Whereas before I would see them every 6 weeks, now I see them essentially every week. They take records from me every week, so I can see them every week, and I communicate straight from my computer. I push a message to them saying, do this, do that, just continue doing what we're doing. Things are going well. You don't have to see me for this amount of time. Or things are not going to plan, come here now. I don't have to wait for the 6-week mark to see that there is a problem. You can just come here right now.
But you could see that patient experience, especially in the private health sector, driving changes where the patients start voting with their feet rather than, so the funding would have to then follow where the patients are going. And I can see that happening. I would want that definitely for myself, having that closer relationship with the dentist rather than having to come in every time with the fear of some drill being put into my mouth. I guess, I think that's a great thing to see that happening. You got some beautiful gadgets here. You wanted to tell us about all of the new other technologies, which obviously, fortunately, I have not had to use for myself before, but I'm wondering what they are.
Of course. So as I said before, everything nowadays for us at our practice starts with a scan. So every single patient that comes to the door as a new patient will receive a full set of photographs, radiographs, but now a 3D scan. And from this 3D scan, we can produce a number of appliances that we'll use for the patient that will increase patient safety and outcomes. For instance, one simple thing when we're placing implants for a patient. Implants are essentially a screw that's drilled into the jawbone to replace a tooth. Now, traditionally, this was done freehand. We would look at the jawbone and insert the screw in there. However, we have lots of very essential landmarks around here that we don't want to hit. There are nerves and there are vessels that we don't want to touch. It is almost impossible to be fully certain that you won't touch them when you're doing things freehand. So this is one example. For instance, this is a surgical guide. And essentially what this does is, coupled with the scan and a CT scan of the patient, we produce this device. They will essentially sit onto the patient's teeth and will guide my drill to where this should be placed. So I know exactly where the implant goes and how deep it should go.
So that cream plastic thing is actually 3D printed.
3D printed here, yes.
So it is a mold which you will then put on the patient's tooth.
Correct.
And actually drill it to the right point that you need to.
Correct.
That's
so
impressive.
If I was going to do this implant freehand, it would take me some time, maybe about 15, 20 minutes of drilling, because I have to do lots of checks to see if I am in the correct angulation, if I am in the correct depth. I need to take some x-rays. With this, the drilling time maybe is 2 minutes, because it's literally going in and out, in and out, in and out. I know where it's going. So the risk is smaller, and the comfort for the patient is definitely much higher. That's one of the tools. There's many other little things that we can tinker with here. These are crowns. So crowns, essentially, when they were done initially, they were a very laborious technique that would have to be done in a dental laboratory, and they would take quite a lot of time to be made. And normally they would come from a dental impression. Most of our listeners will know what a dental mold is. They would have had one. It's not the most comfortable thing. Nowadays, when we do need to do a crown, essentially we take a scan of the patient. This is sent virtually to the laboratory, and they will manufacture a crown like this with a milling machine. We're going to have a block of some sort of material, a porcelain material. That material will be milled into a crown like this that will be custom made to the patient's tooth and will just sit over the patient's tooth. This can also be done at the dental surgery. A lot of dentists will have a milling machine, so they don't have to send it to an external provider, and it can be done on the same day. The patient will come, will do the preparation for the tooth, take a scan of the tooth, and this will be cemented in an hour or so.
But then a lot of this technology also places different pressures on the profession, doesn't it?
Certainly, yes. Keeping up with all of this is not easy. This is a space that changes much faster than we are accustomed to. Definitely dentistry is an ever-evolving field, as medicine in general is, and keeping you updated, it's not an easy task. But when it comes to the virtual and the digital space, it is just much faster. We work with maybe about 7 different softwares for the things that we are doing. There are updates almost every month. So getting
new
ahead
functionalities.
Yeah, the new functionalities and different workflows. So doing all of that is quite a lot of time. And this is one of the things that makes me wonder over in the future, how are we going to be able to keep up with all of the changes? Because there are so many.
And almost makes you think about the impact on training and how it has changed from the time when we got trained maybe to now. And
Yes.
How do you make the training be able to absorb that and not make it a more continuous learning system rather than something where you just go and do a course and a certificate and you're done for life? That rapid change of technology needs you to do it. Do you see any other challenges to dental practice as such from the technology?
I definitely do. So one of the things that we obtain from a dental scan as well are clear aligners. So that's something, it's an orthodontic treatment. Essentially, when you're trying to move teeth and straighten teeth into a certain position that traditionally were done with braces, metal braces that most people will be familiar with. The newer way of doing this is clear aligners. So these are devices like this. Essentially, it's a small plastic tray that fits over the patient's teeth. And this is a series of aligners, maybe about 20, 30, 40 of those, that slowly will move the teeth into a certain position. Now, this was traditionally done by companies. There are many companies that do this type of work, but it can also be done by the dentist with a 3D printer in-house. The problem that I see with this is that the same technology is now used for do-it-yourself providers, where essentially the patient will go, well, a client, not a patient at this stage, will go to a shop front where they will have a scanner just like this. You're going to get a scan and it will be sent to a provider that will manufacture the aligners and send you home with all your aligners. There is no dental monitoring though. There is no dentist monitoring the whole process. And this comes with a lot of issues, a lot of risk, because we want to make sure that the dentition is at a good state before we start any course of orthodontic treatment. And this is not possible when you go to a shop front where there is no dentist present. So this is one of the challenges. I definitely see a much larger influx of providers of do-it-yourself dentistry with this type of technology.
How do you see this impacting the new dental graduate coming out? And how does it impact this practice of keeping on top? And do you see the future of dental practice changing significantly to be able to keep up with the course
Yes.
of training and new technologies which are coming across it?
Dentistry is a specialty that always loved its gadgets. So we've had many different gadgets and technological leaps over time. Lots of them are now obsolete. There are many things that we don't use. So there is a point to be made of what are you actually going to buy and going to use over time to keep your costs reasonable, but also to improve your outcomes. Because I know of many dentists that purchase big machines that were way more expensive than this that they don't use. So there's a selective process to be had when you're buying technology for your practice. In terms of the training, when I was in dental school, I didn't touch a computer ever for anything. There was no reason to. Nothing was done in a computer. The dental graduate today also doesn't do much in a computer. So they come out of dental school with very little or no exposure, and definitely no training, onto those things that we are talking about. I think the advantage is that the generation that's coming out right now is much more used to computers. They are used to this. So picking this up is not that hard as it would have been maybe for you and me. So that is an advantage that they definitely have. But in terms of training, this is still not part of widespread training.
How do you see future research getting impacted through these models?
Well, there's a couple of interesting things. For instance, one of the challenges that we've always faced in dentistry is detecting minute changes in someone's dentition. It is visually almost impossible to detect changes in such a small area, right? So we're talking about teeth that will have maximum of 10 millimeters in length, and we are trying to track changes in 32 of those teeth, if the person has their own other teeth, over the course of a lifetime. Hopefully we'll see the patient for 20, 30, 40 years. Checking those changes is very hard just visually. So with scanners, for instance, if we scan a patient very often, let's say every year that they come to the practice, we can subtract those images from time to time and check what are the changes, what is changing. This is definitely going to be used in research. How are population dentition changes happening throughout time? We are seeing now an epidemic of dental wear. So the two main dental diseases that we have is dental decay and gum disease. They are not going away anytime soon. It's still huge. Still, decay is the number one disease that we have in Australia, believe it or not. But the third one that we hadn't seen in the past, and now is much more prevalent due to lifestyle choices, is dental wear, which is very hard to diagnose in its early stages. And with these devices, we can detect dental wear initially. And then instead of doing massive intervention, which is usually required for dental wear, we can just use preventative measures to prevent these things from getting blown out of proportion, expensive, time-consuming fixes.
And there have been changes of those sorts even in orthodontics and braces, haven't they? As in how the relationship, even the scientific theory around airway and dentition as a cause and effect has changed, and has led changes to therapy as well, haven't it?
Certainly. This is by no means my area of expertise. I don't usually treat many children, but we do know that airway has a lot of impact on someone's health over life. We know that if you have sleep apnea and if you don't breathe properly, you're going to live probably a decade less than someone that doesn't have sleep apnea and its comorbidities. Now, airway is strictly related to dentistry because, of course, your airway starts over here in your mouth. So the way that tradition did orthodontics in the past would be removing 4 teeth and then pull lots of your teeth backwards. That would restrict the space for your airway. You would push your tongue backwards. You would remove that space over there, and you would have breathing difficulties over time, and it would increase your chances of having sleep apnea at a later age. This thinking has definitely changed. Very rarely you'll find someone that would want to extract 4 teeth in every scenario as it was more in the past. It's still something that has to be done from time to time in certain situations, but most of the time we try to prevent that. We try to, instead of removing teeth to gain space, we will expand your arches. We would move teeth outwards and give more space for your airway, essentially.
So clearly with technology, it looks like dentistry is moving into a new space, and like you said, it's always evolving. How do you see these changes impacting the dentist's own practice as such? As in, the practice has changed with dental technicians and dental hygienists over the past. What do you see the future role of dentist being like in that multidisciplinary model of care for the patient?
It's an interesting question. I see myself in the future, not right now, but definitely more in the future as more of a coordinator of treatments and getting the treatment plans ready to be executed. And hopefully one day when we talk about the future of the real future later on in robotics and how that could work for the dentist in terms of we are preparing the treatment plans, things that will not be able to be done by a computer, but then the execution of those is done in a more efficient and safer way by either a robot or by another team of professionals. It doesn't have necessarily be the dentist. I don't see my future sitting chairside and executing treatments day in, day out. That's not what I see for my future, certainly. We have an expanded team of people as well, like whereas in the past it would be the traditional dentist with one room, one nurse, one receptionist. That's not the reality of the modern dental practice. We'll definitely have a team of people with hygienists, therapists, oral health therapists, dental prosthetists, a team of people working for the benefit of the patient so things are quicker and safer. If you look at our team nowadays here, we definitely don't have a team of just me and a nurse. There's a number of people, and they all have expanded functions. The average dental nurse has changed a lot as well, at least in our practice. The traditional dental nurse would be just using a suction, and that's all they would do next to the patient, just removing saliva. Now, our nurses, they all are trained into 3D printing, into 3D designing. They all need to learn computer stuff. So that's quite new as well. When we hire a new nurse here and they're expecting to do just the traditional nurse work, they are in for a shock because they will have to sit in front of a computer for a lot of the time. It has changed the market a little. So when I'm hiring someone new, I'm definitely looking for those skills. Like, are you able to learn all these new 3D skills that you're going to need to learn and do when you are at the practice? So I don't do all of this stuff myself as well. It would be a lot of labor. My whole team is trained to work with scanners, printers, laboratory work. All of them do all of these things as well.
It's almost like a multidisciplinary, multi-trained, multi-specialty task force. Almost.
It definitely is. It has changed a lot in the types of skills that we need to have. As dentists, traditionally, we already tinker with engineering, with artistry, with photography. Lots of those skills are incorporated in dentistry. I guess the challenge is how to train everyone in a consistent fashion to know all of these skills, because they don't come naturally and they are not part of the traditional dental school.
It's almost like having a base foundational level and then learning on the job, I guess, because especially when technology is moving so fast.
Yes.
What do you want them to be trained at? Because if it's going to be obsolete in 3 weeks' time, would you really want them? Yeah, is it worth it? Or just having the base foundation? And that's the same challenges we feel in medical practices as well these days, is what do we want our medical students to learn? You raised that interesting point about robotics and the implications. Do you want to explore a bit more about the implications of future robotics in dental practice?
Yes. What's challenging, I think, in dentistry compared to medicine is interventions in medicine, many of the times are done when patients are unconscious and not moving. In dentistry, 99% of the time our patients are moving and they are conscious. So using robots when we do get to that stage will be a little bit of a challenge because we need to account for patients' possible mobility. Having said that, it has happened already. In China in 2018, there was a case where they got a robot to insert 2 dental implants onto a patient that was awake. So it was taking into account the movements of that patient. I see a future, and I'm still here to see this future, where we can definitely use robotics to deliver care in a faster and more cost-effective way. Because at the moment, if I need to work on 10 teeth in someone's mouth and I only have my 2 hands, even if I had more hands, I can't fit many hands inside a patient's mouth. So if I work that in 10 teeth, it may take me 10 hours to do all of that. If I can have a small robot full of drills, I know this sounds like horror movie stuff, but it can be done safely. It will be done in 1 hour instead of 10. So there is a space in the future to use robotics to improve patient care.
And that'd be even safer because that would mean less anesthetic for the patient.
Definitely.
Yeah, if it can be done rapidly and screened.
Yes.
And on the other hand, it also is a big risk for dental practice itself on where it's moving. But again, that's happened in radiology, that's happened in robotic surgery, in medicine as well. And you just evolve, practitioners evolve with the technology around them rather than becoming obsolete.
Definitely. It's an interesting point, because the general public's view of dentistry is not that it's that we are a self-serving profession in some way. And we are actually not very. We pushed for fluoride for the longest time, even though we knew it would reduce the amount of work for the dentist significantly. And it has. It has reduced, thankfully. So we reduced the epidemics of dental decay, not to a level that we are happy with yet. But we are very much a preventative profession. We try to prevent disease quite a lot. So I think pushing for things that will, even though they will reduce our busyness in some way, but it will increase safety, is in the nature of dentistry. It's something that we already do. We try to reduce the expense for the patient. We try to reduce the risk and increase the safety, increase the quality of care, and be more accessible as well for patients.
Do you see artificial intelligence or any other tools having impacts on dental practice into the future?
There are already studies in artificial intelligence, especially in the space of radiology, for interpretation of radiographs. Although probably the radiographs that we use in the everyday dental practice are not nearly as complex as the ones that we use in medicine. There are many areas that are missed, many things that are not seen by the dentist in situations. So there are studies already with AI identifying problem areas that will need a second look. This is a space to watch, but I don't think it's too far off. I think maybe in the next 5 years or so, this will be something that we'll be using already daily in a dental practice.
And I can see those images, the scanned images. If you had a big repository of those, you could model wear and tear and also dental, friction and those sort of things.
Certainly, yes.
It'd be a great, it's a great thing to watch for in the future. To close off, do you see, so what would your ideal future for dental practice look like? Or how do you see yourself practicing in 10, 20 years from now?
I didn't think that far ahead yet.
Yeah.
But I do see a practice where I'm more of a coordinator, because I know that a lot of things will be replaceable. I know that many of my skills, my manual skills, are replaceable. Anyone will be able to do them, and a machine will be able to do it. What I know that's not replaceable anytime soon is our expertise into diagnosing and treatment planning patients. We are miles away from where medicine is in terms of diagnostics and treatment planning. We do not have firm guidelines on many things, and this is partially because we work a lot alone and not on teams, as you guys do in bigger teams in hospitals. That's not the reality of the dental practice. It's essentially my mind with other people around me here. So I would see a space where I am coordinating and thinking deeply about patients' problems, but I'm not going to be implementing the treatments. I'm expecting a larger team or machines to be delivering that care.
Okay. How do you see mobile technology working in this space?
Mobile technology?
Yeah, such as apps or self-monitoring apps by patients.
Well, we already use them. As I was saying before, on the orthodontic care, patients already use their phones and a retracting device to take photos and videos of themselves, so I can see them on the screen weekly. So this is already part of what we do right now. Apps are definitely there. In other spaces, in the cosmetic space, for instance, this is something that probably spanned from Instagram and Facebook and the like, where patients can just take selfies of themselves and have a look at what will be a different smile, what a different smile will look like on them. So many companies have already now grabbed that technology for themselves and are using them to sell commercial products to straighten teeth or to whiten teeth. Like, how would you look like with whiter teeth? Take a selfie, here you are, go to the dentist and get this done. So there's definitely a space to watch as well.
Yeah, you could just you could make a portable probe of your 3D scanner.
That would be amazing.
Yeah,
that would be great. If this has to lowering cost a little bit, but that would be probably ideal, because then teleconsultations would be full, right? We can definitely do the whole diagnosis if a patient had the ability to scan all the.
So I've seen them in practice with ear, nose, and throat examination, where they actually give you the device, the family buys it, and you can connect with your GP when your child is sick, and you can put a ear probe. You can do the ear examination remotely as well. The future is exciting.
It is exciting.
And that's great to see. So you highlighted about your past and your training in palliative care, and now you're training in psychotherapy. And it also brings an interesting point around dental analgesia and how that has evolved over time. And obviously the issues with chronic pain with dental procedures, and how I've seen that evolve and actually evolve for the better, how analgesia is used. And you obviously have had an interesting journey through this. How do you see that aspect of analgesia pain management impacting dental practice, and also the impact on a workforce who are trained more in the softer skills of rather than the manual skills of dentistry?
Well, there's a lot to be said about all of those topics, so I'm going to distill into a couple of different areas. In terms of analgesia or anesthetics in dentistry, we have evolved quite significantly, where a trip to the dentist does not need to mean pain. Most of the time, it actually doesn't mean pain. Patients will be pain-free and will be numb and will be comfortable as possible when there's someone working in your mouth. But we have, the anesthetics have evolved, the drugs have evolved, the techniques have evolved as well. In fact, we use a computerized delivery system for anesthetics. We don't use a traditional syringe with a needle. We use a little soft handpiece that still has a needle attached to it, certainly, but works in a controlled pressure delivery. So the patient feels very little of what we are doing. And most of the time, they actually don't know that I'm injecting them. At the end of the procedure, I ask, so are you going to inject me? I'm thinking, this is done. I finished the injection already. That's why you're already feeling numb. Now, from the pain side of things and the psychotherapy, it is important to recognize that one of the areas that are very gray in dentistry is chronic pain. We have a lot of patients with chronic facial pain. And this is an area that in dental school, again, it's not really taught very well or very much. There's very little exposure to that. So after university, this is something that interested me a lot. So I studied a lot of that. And with any type of chronic pain, there are mental health consequences to chronic pain, but also we know that mental health can be the other way around, right? It could be causing the experience of pain to be heightened. So that led me to study psychotherapy more recently to help my patients. So in my journey, I'm trying to combine these little bits and pieces of technology, mental health, chronic pain, and trying to join this together to deliver better care. A number of my patients have chronic pain, and I know that I can deliver a different type of experience knowing more from the mental health side of things. Not that I deliver psychotherapy in this setting, but I definitely understand a lot of mental health to be able to direct them to where I would like them to go. A lot of dentists would be quite uneasy having to tell the patient that, look, there's a mental health issue here that needs to be addressed. And a good way of addressing this to help you is seeing this person. It's something that we are definitely not trained to do in dental school. It's a hard conversation to have. So I guess this additional training has given me this ability to be able to direct the patient and help the patient see some things that would normally be hard to see, and explain to them that your pain is not purely physical. No pain is purely physical. There's always an emotional component to pain. So that's part of my journey and part of what I work with in the practice. Yeah.
And it's interesting, and also the way you describe how the role of the dentist is evolving and how we have to rapidly adapt to what technologies around us. We also have to adapt to what our patient needs are. And I think the whole aspect of specialist medical care and what we've learned through COVID, where the subspecialization and yet having a broader sense to be able to reallocate workforce or pivot yourself based on where the industry is heading is very important, I think. So that's an interesting point you've highlighted there.
Well, it is in dentistry. It's very broad. Medicine is definitely much broader, but dentistry, being already a specialty of medicine, is a narrower field, but within dentistry we have many different subspecialties. I feel though that being very specialized is not really a great advantage in dentistry. You would be better placed knowing more of the whole than just knowing of the single little tooth over here. I want to know more of the person. I want to know this person as a whole, and how can I help you live a better life, not having a prettier tooth on your lower right hand side at the very back. That is not that relevant. But if I can give you a better holistic view of what you are and how better can you be with all these changes that we can implement together, I feel that this is a better outcome.
Yeah. No, it's been great talking to you, Celso. Thank you very
Amit.
much for giving us your time.
Thank you very much. It was a pleasure.
So that's all we have time for this episode. Thanks for joining me on the show. If you enjoyed the podcast, make sure to like, share, and subscribe on whatever platform you are on right now.